In this corrective exercise protocol, we're going to be going over the knees move inward exercises. So now we have our foam roll for the first section that we're going to be working on. And Alex is going to go ahead and show us how to do the cat. We did these in the pronation distortion, but we're going to go ahead and give a quick brief review of those as we go through here, Jim. So Alex is going to show you how to do the calf muscle, the gastrocnemius and the soleus. So with this one, the difference is we're going to focus on the whole calf muscle as opposed to just the outside of it. So Alex, again, seek and destroy. We look for those tender spots. He finds a tender spot, and he's going to hold that area for 30 to 45 seconds, or ideally until that area releases. That's why it's called a self-myofascial release technique. All right, so then he's going to go into the adductor. So now he's got the middle thigh area. So he's going to have one leg. That's going to go on the inner thigh. Just like that, perfect. So this foam roll is perpendicular with that inner thigh area. And he's just going to go up and down. Again, seek and destroy. Look for tender spots. So say you found a tender spot, you hold that for 30 to 45 seconds. Okay? Then we move on to the bicep femoris. So now we're going to go back to the hamstring area. So there you go, just like that. So he's going to be on the outside of the hamstring region. I mean, he can still go into the whole hamstring area, that's okay. But the main area you want to focus on is the outside lateral aspect of the hamstrings. That might be a little bit far. So you can turn a little, there you go. And trying to really get that bicep femoris shape. And then he's going to move over a little farther onto the side there, that TFL. This leg's going to be in the front. Remember that Vogue position I talked about earlier? And he's just looking for those tender spots. Once he finds one, he's going to hold for 30 to 45 seconds. Perfect. All right, now we're going to go back into our static stretches. So I'm going to take this, you're going to lay down, please. And we're going to go over the bicep femoris stretch again. So that's going to have that leg up straight, grab just like that. You got that kind of, a lot of people call that a cord. He's grabbing that cord, he's going diagonally as if he's going towards that shoulder. No bouncing, he's going to hold that static stretch for 30 to 45 seconds. Perfect. All right, we're going to go ahead and stand up. We're going to have, Alex is going to face the camera. And he's going to actually stretch the adductor, so the inner thigh muscles. So there you go, just like that. And you want to be careful of that knee. So he's got this area here he's going, and what you want to do too is if you push the hands at a 45-degree angle, just a little bit, not too much, you're actually having to stretch out that inferior capsule, which will allow you to get a little more range of motion in that area as well. Chest to be high, so you're not going to bend over, and you would hold that position for 30 to 45 seconds, no bouncing. 1 to 2 times. Good. Okay, following along, we're going to come over to our chair again. Alex is going to give another demonstration of how to stretch the calf muscle. So we got this is your calf, the gastrocnemius. So that leg is straight, that heel, remember as I described earlier, is bolted to the floor, so you're not letting the heel come up. Alex is going to keep his chest high, belly in tight, and he's going to hold that position. There's a stretch here in the gastroc muscles. He's going to hold that for 30 to 45 seconds, no bouncing. He's going to bring the foot in closer. He's going to bend that knee about 30 degrees. Again, looking to stretch the lower part towards the ankle, that's soleus muscle. Hold for 30 to 45 seconds, no bouncing. Very good. Now we're going to do the TFL. So that foot's going to be in the back. You're going to do your side bending. There you go. You can keep the chest up. Lean to the, there you go, side bend just like that. She's looking to stretch that lateral aspect of his thigh. No bouncing. Hold for 30 to 45 seconds, 1 to 2 times. Perfect. Make sure you got all those. You did. All right, so now we're going to go isolated strengthening. So we're going to have you go ahead, since you're standing, on your exercise, isolated strengthening, there's the lateral walking. So Alex is going to have this. There we go. He's going to pull that apart. And what he's going to do here is he's going to keep his knees straight ahead. He's not going to let him crash in or bow out. And he's going to take small steps while keeping tension on that band the whole time. He's going to take a couple steps towards me. Good. Don't come in too far. Good. So 5 steps this way, and then you take 5 that way. And you notice he's not side bending. He's not doing any of this to compensate. He's just firing those glute medius muscles. Keeping good alignment of the knees. And again, 3 sets of 10 each side. Perfect. Okay, you might keep that off. Let's have you grab a seat. just like we did in the pronation distortion, there's a couple other exercises that you do with this protocol that you also follow along with that one as well. So we're going to go over the dorsiflexion again. There you go. So your band can be tied off on your table or wherever. You're going to hold this down, and Alex is going to bring his foot straight up. Again, working that anterior tibialis muscle. Hold for a second. Come on down. You would do 3 sets of 10. Work his way up to 3 sets of 10 of those. Okay, now we're going to do an inversion. We'll bring this foot over. Alex, again, is going to hold his knee. He's going to stabilize there and at the hip, so he's not compensating up anywhere else with that kinetic chain. He's going to focus strictly on just the ankle joint. We're going to hold here. I'm going to pull this. And he's going to move to the in position to neutral. So he's going to pull inversion back to neutral. Okay. You're going to want to watch your clients. They tend to want to come all the way back over here. And you don't want that. You just want them to work within that range of motion from neutral to as far as they can go with inversion and work their way up 3 sets of 10. Okay. Making sure we cover everything. Last but not least, in the isolated strength, Alex is going to lay down flat for me. I always like for this exercise, this is the one leg bridge, single leg bridge, one leg bridge. And what he's going to do is he's going to actually bend this leg up, go back, relax. I like to usually use a tennis ball, and I'll put it in here and I'll have him bring this up. Go ahead and grab a hold of that knee for me. There you go. And hug that. Don't let that tape fall out of there. What this allows, when you have that much hip flexion, it prevents your lumbar spine from cheating and doing more of the work that you really want the glute max muscle to do. So by this guy, so if you have these tilting in different directions, you have flexion on this side, extension on this side, that lumbar area can't help you cheat. But to really make sure you're keeping good flexion, put something in that hip, pull it up and say, don't let that fall out. Okay, so now we know we're really isolating that glute max, and you'll see that there's not a lot of range of motion when we don't have all that compensation. So, Alex is going to have his foot out here, toes loaded so they're going to be pointed up, just like that. He's going to drive his heel into the ground, belly and tight, and he's going to pick his hips up. Hold for a second, and come on down. Come on back up. Perfect. That's an excellent way to really isolate the glute max muscles. Okay, so come up, hold for a second, and down. You go ahead and relax. So 3 sets of 10, you work your way up to 3 sets of 10 on each side. Okay, good. Now, one integrated dynamic movement. What we're going to have now is we're going to have Alex demonstrate just what I call a kinetic squat. So he's just going to work on taking all of what he just did to try to lengthen the short, tight muscles and strengthen the weak muscles and get his nervous system to start firing and telling muscles when to activate. He's going to integrate that into a total body movement. So what I would have him do is, right here, he's going to go ahead, belly in tight, chest high, and he's going to give me the come down, boom, and come back up. Hinging at the hip. So we're going to watch to see how all this work plays out. So stomach in tight, and come on back up. He's got the arches up, knees in good alignment, belly in tight, stand tall. Perfect. Not the toe joints. You want to put those toes flat. There you go. You that. Arches up. You got it. Okay. So again, what you're doing is taking all that work that you just did through the corrective exercise progressions and integrating that into one total body movement to get your nervous system to fire muscles when they're supposed to fire. So you're correct, that's where the name corrective exercise training comes from.